Medicare is going to look very different in 2026, and if you're not paying attention, you could end up paying hundreds more out of pocket, or worse, lose coverage you thought you had. I don't say that to scare you, I say it because I've seen far too many folks hit with surprise bills simply because they missed a deadline or didn't realize their plan was changing. So today we're going to walk through the biggest Medicare changes coming in 2026, the actual dates you need to circle on your calendar, and the projected costs that could hit your budget. If you want to avoid costly surprises and keep your healthcare predictable, stick with me through this video. The single most important time frame in Medicare is the annual enrollment period, also called open enrollment. Every year it runs from October 15th through December 7th. The decisions you make during this 7-week window take effect on January 1st of the following year. Here's what you could do during that period. Number one is you can move from original Medicare into a Medicare Advantage plan, or back the other way into original Medicare plus a Part D prescription drug plan and maybe a Medigap plan. Number two, you can switch from one Advantage plan to another. Number three, you could change your Part D prescription drug plan or even drop it entirely. Though keep in mind, if you drop Part D and try to pick it back up later, you're going to likely face a lifetime late penalty that you're not going to like. Bottom line, this window is not optional. If you sit it out and your plan changes, you could be stuck with higher premiums, drop prescriptions, or coverage you don't want. Coming in 2026 might be some financial shocks for retirees. The numbers I will be going over are projections, which means that the final official numbers could end up being a bit lower. Let's get to the numbers. And trust me, this is where most people will feel the hit. First, Part B premiums. In 2025, the standard premium is $185 per month. Projections show that in 2026, it could jump to $206.50 per month. That's an extra $21.50 each month, or $258 a year for every single person on Medicare. Second, the Part B deductible. In 2025, it's $257. In 2026, expected to be closer to $270 to upwards of $280. If you're on Medigap Plan G or Plan N, this is going to be a direct out-of-pocket expense for you. Third, prescription drug cost. The catastrophic cap, which is your maximum out-of-pocket for prescriptions, is projected to rise from currently $2,000 here in 2025 to $2,100 in 2026. Now, the maximum Part D deductible also goes from $590 in 2025 up to a maximum of $615 in 2026. And for the first time, most Medicare Advantage plans are expected to add drug deductibles on tiers 3, 4, and 5 medications. And these are your higher cost drugs. One last item that catches a lot of folks by surprise is IRMAA. That's the income-related adjustment on Part B and Part D premiums. For 2026, it's based on your 2024 tax return. So if you retired in 2025 and your income dropped, you can file Form SSA-44 to appeal. Don't let that slip by. So what do you think is the very common mistake that we see each year around this time? Not reviewing changes in your current Medicare Advantage or Part D prescription drug plan for the coming year. Here's the part most people underestimate. Medicare Advantage and Part D plans change every single year. They are a one-year contract between the insurance companies and the government. We saw well over 1 million people lose Medicare Advantage plans in 2024 because contracts weren't renewed. In 2026, some insurers are scaling back or even exiting certain markets completely. That means you need to review your annual notice of change. The ANOC letter you have already either received, but if you haven't, it should be in your mailbox before October 15th. You need to compare it line by line to your current benefits. Things you're going to want to pay attention to include premiums, deductibles and copays, your plan's maximum out-of-pocket, the provider network. Remember, just because your doctor's in the plan now doesn't mean they're going to be there in 2026. The drug formulary, whether your medications are being dropped or bumped into a higher copay tier. Let me give you a real-world example. A couple of years ago, we had a client who tossed her ANOC letter right in the trash without even reading it. She assumed the plan she had was going to be exactly the same for the upcoming year and even declined an annual review meeting with her agent. Wrong thing to do. Her Medicare Advantage plan dropped one of her brand name prescriptions for the upcoming year. By January, when she went to the pharmacy, that prescription jumped from a $45 copay to now costing her over $400 per month. Now, we were able to move her into another plan during the open enrollment election period, but not only was it stressful, but it was a wake-up call, a very expensive $400 wake-up call for her. That's why we always tell folks, do not ignore that ANOC packet. It's the single most important piece of mail you'll get about your coverage. So before we wrap things up, let's clear up a big confusion point. The fall annual election period has nothing to do with Medigap. Medigap benefits don't change year to year. You can apply to switch Medigap plans at any time. But in most states, switching means going through medical underwriting. So if you're having a lot of health issues, you can be denied. Now let's quickly review one other enrollment window you should at least know about. It's the Medicare Advantage open enrollment, which runs January 1st through March 31st of each year. While some folks call the annual election period the open enrollment period, this is not technically correct. There is an actual Medicare Advantage open enrollment period. As I just stated, it runs from January 1st through March 31st each year. This enrollment window is much more restrictive on what changes you can make. If you're already in an Advantage plan, you can switch to another one or drop back to original Medicare, plus get a Medicare Part D prescription drug plan. But you only get one move during this period. Here's the reality. Doing nothing could cost you in 2026. Higher premiums, higher deductibles, or a plan that no longer fits your needs. Don't assume your plan will roll over the same. Take the time to review it. The best place to start is simply by contacting us. Our team is very well versed pretty much on all things Medicare. You can reach us quickly by calling 1-800-924-4727, or you can even submit a request through our website, www.seniorbenefitclient.com. Our goal is simple. Help you avoid the stress of surprise bills and make sure your healthcare budget is predictable and protected. If this breakdown was helpful, go ahead and subscribe so you'll get the latest updates as soon as the official 2026 numbers are finalized. Bottom line, protect your budget, know your dates, and don't get caught off guard. Thanks again for watching. We'll see you next time.